It's a scenario I think a lot of people with chronic health issues find themselves in. You're sitting there, your heart is racing, your stomach is in knots, maybe you feel dizzy or just wrong, and you start Googling. And suddenly you see this one term popping up everywhere, the vagus nerve.
The master regulator.
Exactly, the master key. And for someone living with adrenal insufficiency, where your body literally doesn't make enough cortisol, it is so tempting to look at that nerve and think, this is it. This explains why I feel like I'm on a roller coaster.
It is tempting, and it's not entirely wrong, but it's dangerous if you stop there, because while the vagus nerve is powerful, it is not cortisol. And confusing a nerve issue with a hormone deficiency can actually be life-threatening.
That's the distinction we are drilling down on today. We're looking at a recent article from My Adrenal Life that tackles this exact confusion. Why does low cortisol feel like a nervous system glitch? And specifically, when your blood pressure starts swinging wildly, is that your adrenals crashing, or is it something else entirely?
It's a really critical question, Noah, because depending on the answer, the treatment is completely different.
So let's start with the basics. The vagus nerve, it's having a moment in pop culture right now. Everyone is talking about vagal tone. But what is it actually doing?
So strip away the wellness influencer hype for a second. The vagus nerve is essentially the superhighway of the parasympathetic nervous system. It connects the brain to the heart, the lungs, and the digestive tract. The Cleveland Clinic describes it as managing your involuntary functions, digestion, heart rate, and immune response. It's the rest and digest counterweight to your fight or flight response.
Okay, so if I'm stressed, the vagus nerve is what eventually calms me down.
Right. It lowers the heart rate. It tells the stomach to start digesting again. It's an electrical system. It works in seconds.
Versus adrenal insufficiency,
which is a chemical problem. Adrenal insufficiency, whether it's primary like Addison's disease or secondary, is a failure of the HPA axis, hypothalamus, pituitary, adrenal. This system produces cortisol. And cortisol isn't just a stress hormone, it's a life-sustaining hormone. It maintains blood pressure, regulates sugar, and controls inflammation. But it's a slower systemic chemical release, not a quick electrical zap.
So we have an electrical wire, the vagus nerve, and a chemical factory, the adrenals. They are different systems. But here is the problem, and the article points this out really well. Symptom-wise, they feel almost identical when they go wrong.
They really do. Think about what happens when you have low cortisol. You get dizzy. Your heart might race because your blood pressure is dropping and the heart is trying to compensate. Your stomach feels awful. Nausea is a huge symptom of adrenal insufficiency.
And those are all things the vagus nerve is supposed to control.
Precisely. So a patient feels nauseous and dizzy, and they think, oh, my vagus nerve is acting up. But in reality, they might be low on cortisol. The lack of cortisol is destabilizing the very things the nervous system is trying to manage. The NIDDK lists fatigue, muscle weakness, and abdominal pain as classic adrenal symptoms. It's easy to see why the wires get crossed in a patient's mind.
The article used this phrase I liked. Low cortisol can affect many of the same body functions the autonomic nervous system is constantly trying to stabilize. It's like the adrenals are cutting the power and the nervous system is frantically flipping switches, trying to turn the lights back on.
That's a great analogy, and this is where we have to talk about blood pressure, because that is usually the scariest symptom for patients.
Right, the swings. 1 minute you're low, the next you're high. The article makes a very specific point about directionality here. If it's a true adrenal crisis, which way is the pressure usually going?
Down. Almost exclusively down. Classic adrenal crisis physiology, particularly in primary adrenal insufficiency or Addison's, involves hypotension, low blood pressure. You are often losing salt and water because you lack aldosterone, another adrenal hormone. You lose volume. The tank is empty, so the pressure drops.
Okay, so if I'm sitting there and my blood pressure is 180 over 110 and I'm panicking, that's probably not an adrenal crash.
It's highly unlikely to be a classic adrenal crisis in the physiological sense. Adrenal crisis is circulatory collapse. The Society for Endocrinology defines crisis by that severe hypotension and electrolyte imbalance. However, And this is the nuance the article captures really well. Patients often report feeling high symptoms.
Yeah, explain that, because I've heard people say, I missed my meds and I felt like my heart was exploding out of my chest.
Think about what happens when your body senses a threat but doesn't have the cortisol to manage it. Your body might dump adrenaline, epinephrine, as a last-ditch effort to keep you upright. So you might get palpitations, sweating, tremors, that internal alarm feeling.
So you're running on pure adrenaline fumes.
Exactly. But even then, sustained, severe high blood pressure is not the hallmark of adrenal insufficiency. If you are seeing repeated, massive spikes in blood pressure, hypertension, you need to look for a second culprit. You can't just blame the adrenals for everything.
The article mentions something called autonomic dysreflexia. What is that?
That is a specific and medical emergency, usually seen in people with spinal cord injuries above T6. It causes sudden, dangerous hypertension. Now, most people with adrenal insufficiency don't have that, but the point the author is making is vital. Autonomic dysfunction, dysautonomia, can exist alongside adrenal insufficiency.
You can have both.
You can have both. You can have Addison's disease and POTS, postural orthostatic tachycardia syndrome. If you treat the high blood pressure from the autonomic issue by taking more steroids, you're making a mistake. Steroids raise blood pressure over time, but they aren't a jagged fix for a momentary spike.
That seems like the biggest risk here. A patient sees a symptom, thinks it's my adrenals, updoses their hydrocortisone, but the problem was actually their nervous system firing off.
Right, and over-replacement of steroids carries its own massive risks: weight gain, bone density loss, diabetes. You don't want to throw cortisol at a problem that cortisol can't fix.
I want to pivot to the secondary and tertiary adrenal insufficiency patients. The article mentions them specifically. These are people whose adrenals might work okay structurally, but the signal from the brain, the pituitary, is broken, usually from past steroid use or tumors. Do they fit this pattern too?
They do, but with a twist. In secondary adrenal insufficiency, SAI, they usually still make aldosterone. Remember, aldosterone controls the salt and water balance.
So their tank isn't emptying out as fast.
Correct. They aren't losing volume as drastically as an Addison's patient. But because they lack cortisol, they lose vascular tone. Their blood vessels get floppy. So they still get dizzy and low blood pressure, but it might not be as catastrophic as quickly. The confusion with vagus nerve issues is actually even more common in this group because they often don't have that classic skin darkening or severe salt craving that warns them it's Addison's.
It's vaguer.
It is vaguer. And because many of these cases are iatrogenic, meaning caused by medical treatment like long-term prednisone use, their whole HPA axis is suppressed. The article notes that starting thyroid medication in this context is a huge trap.
Oh, I saw that. The FDA warning.
Yes. If someone has undiagnosed adrenal insufficiency and you give them levothyroxine for their thyroid, you rev up their metabolism. Their body suddenly demands more cortisol to handle the new metabolic rate, but they can't make it.
So you rev the engine but cut the fuel line.
And you send them straight into an adrenal crisis. That's why checking adrenal function is standard care before treating hypothyroidism. It's all connected.
Let's go back to the lived experience. The article validates that the vagus conversation is helpful even if it's not the root cause. Why is that?
Because it gives people a language for the trauma their body is in. When you live with a chronic condition like this, your body feels stuck in alarm mode. That is a nervous system state. Understanding that stress impacts your digestion or that you need to actively work on rest and digest protocols is beneficial.
It helps manage the lifestyle side of things.
Exactly. Deep breathing, cold exposure, humming, these vagal tone exercises can help calm the autonomic nervous system. That might reduce the demand on your cortisol. But, and this is the big but, no amount of deep breathing will replace the hormone you are missing. If you are in crisis, you need hydrocortisone, not meditation.
It's about hierarchy. Biology beats mindfulness when the organ is failing.
Biology always wins. The article says it perfectly. The vagus nerve does matter, but it is not the same thing as cortisol.
I want to touch on the storms. We hear about cytokine storms or thyroid storms. Is there such thing as an adrenal storm where everything goes high?
Not in the way people think. There is a rare condition called pheochromocytoma, which is a tumor on the adrenal medulla that pumps out adrenaline. That causes massive high blood pressure storms, but that is the opposite of adrenal insufficiency.
Right, that's too much hormone, not too little.
Exactly. If a patient with adrenal insufficiency is having storms of high pressure, high heart rate, and agitation, they shouldn't just assume it's their adducens acting weird. They need to look for other causes. Dysautonomia, POTS, thyroid issues, or even simple things like medication interactions.
It sounds like the danger is diagnostic anchoring. You have one diagnosis, adrenal insufficiency, so you try to fit every single weird sensation into that one box.
Diagnostic anchoring is a real problem, and the internet exacerbates it because you can find a forum thread somewhere where someone says, "Oh yeah, my Addison's made my blood pressure 200 over 100. Anecdotes aren't physiology. The Johns Hopkins literature and Endocrine Society guidelines are very clear on what a crisis looks like. We have to trust the physiology.
So, if a listener is dealing with this, they have the diagnosis, but they feel unstable, unpredictable, one day steady, next day chaotic. What is the practical takeaway here? How do they distinguish the signal from the noise?
Start with the data. Track the blood pressure. If you feel terrible and your pressure is 80 over 50, that tracks with low cortisol. That's a signal to look at your dosing or stress dosing. If you feel terrible and your pressure is 150 over 95, hold the phone. Don't instinctively stress dose. Pause and evaluate.
And probably call the endocrinologist.
Absolutely. Tell them, I'm having hypertensive episodes. Let them screen for the other stuff. Don't just suffer through it thinking it's part of the package deal.
It's interesting looking at the history of how we treat these things. Addison's was fatal before the 1950s. We didn't have synthetic steroids. Now we have the meds, but we're struggling with the nuance of management. It feels like we're in a new phase of understanding the disease.
We are. We moved from how do we keep these people alive to how do we give them a quality of life? And quality of life means understanding that the body is an ecosystem. The adrenals don't live in a vacuum. They talk to the thyroid. They talk to the vagus nerve. The nuance is where the quality of life lives.
And part of that nuance is accepting that not everything is the hammer and not everything is the nail. Sometimes you need a screwdriver.
Or a nap, or a beta blocker, or just some salt.
One thing the article mentioned that I want to circle back to, the emotional toll. Living with adrenal insufficiency can make your body feel unpredictable. That unpredictability creates anxiety, which then
Triggers the HPA axis.
Right. It's a feedback loop from hell.
It is. Anxiety demands cortisol. If you don't have it, you get physical symptoms. Those symptoms scare you, you get more anxious, you demand more cortisol. It spirals. This is where the vagus nerve knowledge is actually empowering. If you can use those tools to break the anxiety loop, you're technically sparing your cortisol. You're preserving your limited resources.
So in a way, managing your vagus nerve is managing your adrenal insufficiency.
Indirectly, yes, it's supportive care. It's not replacement therapy, but it is supportive. Think of cortisol as the fuel in the car and the vagus nerve as the driver's driving style. You can't drive without fuel, but if you drive aggressively, you burn fuel faster. If you drive calmly, using that vagal tone, you make the fuel last longer.
That is a fantastic way to visualize it. It stops it from being an either-or situation.
It has to be and. We are complex biological machines. We need to respect the complexity.
Before we wrap up, I want to address the safety risks mentioned in the intro. We talked about thyroid meds. We talked about missing other diagnoses. Are there other pitfalls people fall into when they confuse these two?
Supplements. That's a big one. People read about adrenal fatigue, which is not a medically recognized diagnosis in the same way adrenal insufficiency is, and they start taking adaptogens, ashwagandha, licorice root, rhodiola. If you have true adrenal insufficiency, some of these can mess with your electrolyte balance or interact with your steroids.
Licorice acts like aldosterone, doesn't it?
Real black licorice does, yes. It can raise blood pressure and drop potassium. If you are already on fludrocortisone, which replaces aldosterone, and you start eating massive amounts of licorice or taking supplements, you can drive your blood pressure through the roof and drop your potassium to dangerous levels.
So again, treating yourself based on a vague concept of adrenal support without understanding the chemistry
can land you in the ER. Exactly. Always run new supplements by your endocrinologist. It sounds boring, but boring keeps you safe.
Boring is underrated when your body tries to kill you on a Tuesday.
Truly.
Okay, so let's summarize the big takeaway for someone listening who feels that whole body instability.
1. Know your numbers. Low blood pressure usually points to cortisol or aldosterone needs. High blood pressure usually points elsewhere.
2.
2. Respect the difference between hardware, nerves, and chemistry, hormones. You need both to work, but you fix them differently.
And 3?
3. Don't go it alone. If the pattern changes, the medical advice needs to change. Don't just guess.
It's a heavy topic, but I think clearing up this specific confusion, the vagus versus the adrenals, is going to save someone a lot of panic.
I hope so. It's about being the expert on your own body, but checking your work with the science.
If you have a friend who is constantly trying to biohack their way out of a complex condition or someone dealing with these specific symptoms, send this episode their way.